Hello, everyone. Thank you very much for taking the time to be here today in today's webinars on strengthening biobanks through patient and public involvement. So my name is Manuela Pausan. I'm scientific stakeholder at BBMRI-ERIC, and I will be your host today in today's webinar. So we have approximately 1 hour webinar, and we will start with just short welcome and introducing the speakers. Afterwards, we will have short presentations from the 4 speakers that we have, which I will introduce them to you shortly. And we will have a discussion and Q&A at the end. Before I start introducing the speakers, just shortly about who we are or who BBMRI-ERIC is. So BBMRI-ERIC is the European research infrastructure for biobanking and biomolecular resources. We are one of the largest research infrastructures in health and life sciences. We've been set up in 2013, and it currently includes more than 500 biobanks from 25 members and observer states, plus the global organization IAC WHO. As a distributed research infrastructure, we enable the development of innovative technology and processes as a cross-domain network that facilitates responsible access to high-quality samples, data, and biomolecular resources. We achieved this not alone, of course, but through multidisciplinary expertise, service provision, service excellence, knowledge exchange, and partnerships in the health and life sciences. Our vision is simplified as biobanking for a healthier world, which you will see it as a logo in our presentation. And the headquarters of the BBMRI-ERIC is in Graz, Austria. I would like to just mention that today's webinar, it's being co-organized together with the Stakeholder Forum, Patients and Citizens Pillar, and it's the first webinar of this series. And we hope that in the future, we will have more webinars coming from the Stakeholder Forum. Coming to the speakers, we have 4 speakers today. Each speaker will have approximately 10 minutes to give a short presentation on different initiatives that they are involved that relates to patient and public involvement in biobanking and how can this strengthen really biobanks. We will start with Erik Vermeulen, who is the chair of BBMRI-ERIC Stakeholder Forum. He's also advisor on patient participation at the post-COVID network in Netherlands, which addresses long COVID, but he will also highlight other roles that he has in his presentation. Then we will continue with the perspective from the biobanks. Actually, we will have Ronnie Baba, who is the head of the Leipzig Medical Biobank, but also involved in different working groups, both in BBMRI-ERIC, but also in the ESPB, and in different initiatives in Leipzig. So he will be presenting different initiatives where patient and public involvement and engagement happens in the Leipzig Medical University, but also in Germany. Then we will continue with a perspective from more the national network, where we will have Sarah Rebling, member of Biobank Sweden's citizen engagement team and department manager at Biobanken Noir. She will be talking about the citizen engagement initiatives that are happening in the Biobank Sweden as the national network, but also of different activities as well. And then we will continue with a different perspective on the patient perspective part, where we will have Albert Cunet, president of Ligue Huntington Francophone Belge, so the French-speaking part, and he will be presenting his involvement, but also other contributions in his presentation, and also would like to highlight that he's also a member of the BBMRI-ERIC Stakeholder Forum Patients and Citizens Pillar. And without further ado, I will actually hand over to the first presenter, which will be Erik Vermeulen. Erik, please.
Thank you, Manuela. Yeah, I'm very pleased to contribute from this the Stakeholder Forum about patient engagement. My name is Erik Vermeulen. I'm the chair. I'm a sociologist, so that's my background. And I will first tell you something about the Stakeholder Forum, because that is important for this context. It contains members of lots of patient organizations in the Netherlands and also EU-wide patient organizations, and our aims are to focus on 3 themes. So digital and data solutions. So we also talk about the new law EHDS. And we also discuss informed consent procedures and the future of consent. And of course, patient and public engagement. So how can we involve and engage with patients and the public in biobanks? And we also have a role in the organization of the European Biobank Week. And there you see all the logos of the contributors. Our stakeholder forum is the main interface for patient organizations with biobanks, and it is an integral part of BBMRI-ERIC's governance and culture. It's a bi-directional relationship between the biobank community and the stakeholders. The stakeholder forum is firmly enshrined in the statutes of BBMRI. So we play a role in organization and decision making. I am involved in different kinds of engagement and involvement. For example, which is long established is engagement in clinical research, so in clinical trials. And we play a role in deciding which clinical trials are going ahead and how they can be done, which is an established function of patient and public figures. And we also are involved in the review of clinical research. So that is through so-called lay members in medical ethical committees through Europe. Not all countries have that, but we have that in the Central Committee on Research Involving Human Subjects. So there is patient representation in every review of the clinical trials. And I'm also involved in engagement in health data research. In the Netherlands, we have a sort of preparation to the European health data space, where also has to be decided on information and consent procedures. But now, this is partly from the slide, but now we're going to continue on engagement and involvement in biobanking, because at the Stakeholder Forum and in BBMRI-ERIC, we had a process to formulate principles and practice examples of public and patient involvement engagement in biobanking. So we hope to entice biobankers to engage with persons, with public and patients. And this was really a large process, an iterative process, in which we, in multiple rounds, drafted a consultation, drafted a paper with patient representatives and advocates, node directors from BBMRI, and ethical, legal, and social experts. And we discussed this in two biobank weeks in 24 and 25. And the document is published on the website of BBMRI-ERIC, and you can see it here. And there is also a sign there that you can download it. We have formulated some principles that we think are very important for the engagement. Have clear objectives for your activities. We'll come back to that later, because there are different kinds of activities possible. Enable that in different levels of biobank governance, and ensure that the representation of patients and the public is going along the lines of diversity. So try to involve different kinds of people, give them training and support, create conditions for compensation or reimbursements, show their contributions, which is very important, of course, so that they don't do it for nothing, and try to make this involvement engagement sustainable. And give transparent and accessible outreach for this engagement. And as a last point is that it's very important to evaluate the impact of the engagement so that you can learn and maybe improve on it. We have defined different levels of engagement and involvement, and it's not the case that the last one is the best one. They really all are okay and important, but at the spectrum, the first part is that you inform people, and we describe how you can do this and what your goals can be. You can also consult people, which is more structural, and you can involve them in consulting sessions. You can also involve them, so work directly with participants and involve them in the policy making of specific topics. You can start collaboration with them, partner with patient organizations or persons, and have formal partnerships with them so that you can have them more structurally involved. And you can empower people, and that means that you have them involved in governance models, so decision making about the biobank. So these are really different kinds of involvement and engagement. And as a biobank, and also as a person, of course, from the public, you can decide what is my goal, and what is the purpose of this engagement, and what is then the following activity. And then you can also use this as a means to evaluate if this was successful. So that was really what I was trying to evoke. So I want to thank you. I look forward to your questions and remarks.
Thank you, Eric. I would like to give control now to Ronnie. Ronnie, please.
Can you hear me?
Yes.
Okay, now you can hear me. Okay, then thanks, Eric, for this very kind and nice introduction. And I will try to show you how we try to use these principles and try to bring them into reality. Although as a biobank, it's not really easy, because we in Leipzig, I just want to show you a bit about us. We are situated at the campus of the University Hospital and the medical faculty here, and you see us here as the biobank. We also have the different stakeholders here. We have our lab here in the Life Center. We have laboratory medicine. We have pathology. We have the cancer center, surgery, children's hospital, hematology, and all are working together in biobanking. But that's what you know. We as a biobank have different entities and different providers of samples in Leipzig. So we have epidemiological studies with live child and live adult. We have the medical part where we are doing healthcare integrated biobanking. So for us, it's not really easy how to use these principles in real life. That's why we as a biobank don't have someone, a patient or a public representative in our advisory board. What we have is we have our single providers from the single studies, and they have within their advisory boards patients and representatives from the public. For example, unfortunately, these homepages are in German. That's why I only have the German text, but I try to translate it. For Live Child, we have a committee, a family and children's committee, and there's also a representative from the public health office. There are also children, parents, pastors, teachers, and so on. And they are doing all the work which is important, and they give us the advice. So that's how we try to involve them in our daily work, because we are just a service provider for this study, and the advice should come from the board there. And this is the same for our cancer center. So we also have a patients and relatives advisory board at the cancer center, which is really active. Unfortunately, this time also the homepage is just in German. But what I wanted to show here is the task. So the advisory board's task is to actively incorporate the perspectives of people affected by cancer into the further development of oncological care. And we as a biobank are just one part of this cancer center, and that's how we try to address this needs of PPIE. So they are doing it as part of equal partnership, transparency and trust, participation and empowerment, diversity of perspectives and reliability and confidentiality. That's what Eric already mentioned, and I think that's also very important for our work. But we see that from a kind of different angle. So it should come from the providers of the samples. And probably also you know what we did last year with the position paper for strengthening academic biobanks and patient participation for biomedical research. I think that was very successful. We also addressed that to funding agencies, yeah, we will now have a big funding period in Germany for biobanks. So I think that was also really helpful to team up and to collaborate with patient representatives. So, but also information is very important, and Eric showed you this 5 levels, how you can interact with patients and the public. And last year at the World Patient Safety Day, we had also a contribution where we showed what we do with our Live Child study. I think that was very nice, and I did that together with Mandy Vogel, who is one of the administrators of Live Child, and that shows how the biobank and the providers or the different study PIs can work together or should interact to go in the same direction. What we also do is we open our doors for different activities. Mainly, we are doing guided biobank tours. Last year, we had the University Hospital Health Day, where we always have such guided tours. And I think that that's really a really cool thing, because patients who want to see the biobank are really active, and there's a good communication between us as biobankers and patients within such a surrounding of a guided tour. And I like that very much personally. What we also did last year was a Live Child Open House Day. And you see there was a question round between the children, their parents, their grandparents, and some researchers. And the people from Live Child also asked me to participate in that round. It was really interesting what kind of questions have been asked by the children, which have been, let's say, from 5 to 15 years. So it was really interesting and a really interactive thing. And you see, we all had lots of fun in this format. What we also do is a long night of science. There we add practical things to the open or to the guided tour, so people can or people and children can do biobank stuff like aliquoting, like scanning, like looking through the microscope, and they also like it very much. And let's say we have around 100 people during these 4 hours who are very interested in what we are doing. So, and you see, this is very colorful because we always do that together with Live Child, and mainly children are very interested in what we are doing there. And something which is new, there's the Bring Your Child to Work Day, and we support that while showing the biobank facility to the children. We did that 3 times last year, and this is also a very nice thing because the children talk to their parents, and then the biobank is also more in the focus of their parents, and that makes us the collaboration with the partners from the hospital also easier. And of course, what I think is very important for a biobank and is a homepage. So information on the homepage, and then so that you can be found as a biobank, and we also offer that to the public. You see here, and one really interesting thing was I received an email from this woman, and she asked if I can offer her a guided tour for, let's say, a best ager single singles. And I did that once in January. I have my next tour in February, so end of this week. And they have been so impressed that they booked a third tour in March. So that's also very important for discussion with the public. And a good homepage is the basis for that. So that's everything I wanted to tell. And I'm really looking forward to your questions later on.
Thank you, Ronnie. And just a moment to give then the control to the next speaker, who will be Sarah.
Let's see if I can. Oh, now we both pressed. Here we are. Hi, everybody. Thank you so much, Manuela. I'm here from Biobank Sweden. My name is Sara Rebling, and I'm here to talk about our citizen engagement and involvement team. So today I'm going to talk a little bit about what Biobank Sweden is, an introduction to our citizen engagement and involvement team, including our methods and our philosophy, and then also some examples of our activities. So first of all, what is Biobank Sweden? We are a national infrastructure for biobanking where healthcare, academia, industry, and patient organizations collaborate for good healthcare and research. So we're not a single biobank, but we are the collaboration, the network of biobanks in Sweden. And here we have our citizen engagement and involvement team. And it consists of 2 patient representatives and biobank professionals working at medical biobanks across Sweden. So this is only a part of what we do. We have other jobs also. So for instance, I work in Umeå in the medical biobank at the University Hospital in Umeå. And all my other colleagues have other positions all around Sweden also. And we do this together as a part of our work in Biobank Sweden. And our method is, let's see here if it works, that there is no fixed method. We, for each project that we take on, we co-create the approach together with the target group using a forum and a setting and a time that suits them. So our philosophy is that engagement and involvement are not possible if you don't have trust. And trust in biobanking depends on the trust in the healthcare system. And I think not only in the healthcare system, but also in the whole country and the government. Because if you don't trust the state, it's very hard to trust the healthcare system. But if you don't trust the healthcare system, it's really hard to trust biobanks. And we have, when we started working on this, we kind of quickly figured out that there are 2 major categories. There are, of course, 100 of subcategories, but 2 major categories of questions. We have the smaller questions, the smaller and easier, and then we have the bigger. And the small questions can get you started. And it's a good way to get started, like before you publicate any information materials, you can make sure that people who have lived experience review the information, that have the experience of being a patient or being a parent to a patient, to make sure that all the questions that you have are being asked and that the answered, and that the tone and the language is an appropriate level. But we think that the significant impact on the patient and citizen involvement and engagement are from the bigger questions. For instance, how we build trust in underrepresented groups. And I'm talking about the groups that are underrepresented in the biobanks in Sweden. So for instance, we have a lot of people that are right now living in Sweden that have lived somewhere else before they came to Sweden. And maybe in their home country where they came from, you couldn't trust the government, or you couldn't trust the healthcare system. And then that distrust is being brought into Sweden, and then they're being underrepresented in our biobanks. And we need to make sure that we build trust in all the groups in Sweden in order to have a biobanking situation that involves all the people that are living in Sweden. Another big question is regarding this. Oh, a second, there we are. We need to also make sure that the Swedish Biobank Act enables medical research also for everyone in Sweden. And we both want to answer these big questions and make a real impact. But for us who are working with this, it's really nice to feel like we're going somewhere and we keep momentum up. So in order to both make the big impact and feeling like we're actually accomplishing something in our everyday lives, we try to work on both the big and small questions in parallel. So we got these big ones brewing, and then we're working with the smaller ones at the same time to make sure that we're both doing stuff here and now and in the long run. And I'm going to give you 3 different examples of these types of questions that we work with. I have so many more examples. If you want to get some inspiration or discuss what we have done, please contact me. My email is in once on the first slide, and we can discuss it more. But I'm going to take 3 examples. So this first one is one of these smaller questions. It had a timeline of 1 year approximately, and it's our collaboration with patient organizations. So we have reached out to a wide range of patient organizations, and we have asked them to come to us with their questions and problems, because we feel like we want the people with the lived experience to formulate the questions if possible. Because if we are asking a committee of patient representatives, like, what do you think about this question? We have already formulated the question and we've already missed something crucial. So we try to make sure that the question, as long as possible, comes from them, to make sure that we get the wider perspective. And we have a dedicated website for this to read about this and know how to contact us in both Swedish and English. This link that you see here is for the English version. But if you are a Swedish speaker, it's very easy to change the flag in the corner. So I thought this was a more appropriate link to send. And we meet on their preferences. Again, they have the lived experience. So we try to make sure to make them be in the leading position for this work. And since these people very often have a lot of other things, like other jobs and things that they do in their days, we very often meet digitally and in the evenings to suit them. And if we decide that, yes, Biobank Sweden can help you with this, then we create the plan together. So as an example, together with the ME, CFS, and post-COVID patient organizations, 2 from Biobank Sweden, me and a colleague of mine, attended their international research conference and discussed how we can support the researcher in the field to get started with biobank research. So these 2 patient organizations reached out to their scientists, the researchers that are working within their diagnosis, and they got them to Stockholm. And I went to Stockholm and we talked with them about how the Swedish law works, how the Swedish system works, which samples are already regularly being saved in Swedish medical biobanks. How do you access it? What can we help with? To make sure to make it as easy as possible for them to get started with their research. But as Ronny very well pointed out, it's not us in the biobanks that are making the research. They are doing the research and they need to make sure to be responsible for that. But we are here to help, and we try to help as much as we can. And my second example is a little bit longer timeline, 2 to 3 years, and it's working with the youth to improve our communication with everyone. So we in Biobank Sweden have previously focused on communicating with adults about the law and about their choices regarding biobank samples, but we have not directly addressed the young people in Sweden. So now we are focusing on, and we have started working a little bit with understanding the current trust levels that we have in the youth, and also identifying what necessary steps we have to take in order to build trust. Because as I said, in our philosophy, we don't try to ask questions before we have trust, because when you ask questions with trust, you get better answers, we believe. So we think we're just starting this process, but we're thinking that we're going to need to go to them and meet them in their arenas, like in schools and wherever they hang out when they are not in schools to talk about biobank samples and about the biobank law and about what we're doing. And after that, we can start to explore where and how young people prefer to receive information. But this is never just a box where you can put a tick like, okay, we did that. We gained trust and then we got an answer and then we moved on, because this will change. So we also need to work on how we can maintain trust in this group, because the youth are new people all the time. So we need to make sure that we maintain the trust in this general group, and we need to be able to adapt our communication in the future when the preferences of the new young people change. And then we have my third and final example, and it's a longer timeline, hopefully only 5 years, but maybe longer. And this is improving the Swedish Biobank Act to include everyone in Sweden. So we got a new Swedish Biobank Act. It came into force in 2023. And it contains a clause restricting the use of existing samples from incapacitated individuals in research. And first of all, who gets to decide who is incapacitated? If I have had a good conversation with the patient before surgery and then they take something out while someone is under anesthetic, that person can't consent right now because we can't talk to that person. But maybe they have consented earlier. Who gets to decide when someone is incapacitated and how long that stretch is? Maybe they wake up the next day, you can talk about the Biobank Act with them. And also, many patients with stored healthcare samples want their samples to be used for research. And I'm willing to say, after I've talked to quite a few patient organizations, especially the people who have diagnosis that might render them being called incapacitated. For instance, people that have schizophrenia, people that have brain tumors, they are really, really, really interested in getting medical research on their samples in order to help people that are getting their diagnosis in the future to make their situation better. So the Swedish Biobank Act is really not including everyone who wants to be included in research as it is right now. So together with many different patient organizations, Biobank Sweden has worked on changing the opinion of the political parties on this issue. And the government has now appointed a commission, a first step to gather different ideas to improve the law, which is awesome that they have taken that step. And now we're working to ensure that biobank samples from everyone in Sweden can be included in clinical trials and in medical research, enabling research results that reflect the entire population. Because only when the entire population of a country is represented in the biobanks, we can have medical research that are actually going to be working for a large portion of the country. And that was everything that I wanted to say today. I see now I probably spoke too quickly because I got it through in fewer minutes than I did earlier. I am sorry if I spoke too quickly. Again, Sarah Rebling, contact me if you want to discuss it more. And I will also, of course, answer your questions later in the Q&A session.
Thank you very much, Sarah. And I will now give control to Albert.
Okay, thank you, Manuela. First of all, I would like to thank the organization for giving me the possibility to share with you some of our concern. And it's amazing because when I listened to the three previous speakers, I heard Eric mentioning the two excellent booklets who define already a clear strategy for involvement, for opt-in, opt-out option, etc. I heard Ronnie speaking of necessity of full life care, and now Sarah being trust communication involving young people, etc. So I guess I could shorten my presentation because I also share the same issues. So in a short overview of our agenda, I will in a few words tell you who I am. my job in the ethics committee in Erasmus in Brussels, my vision of what needs research, what research needs, how to achieve that goal, and maybe other solutions to involve patients than only BBMRI. So first one, as you see, maybe I'm 80 years old, neither a scientist nor a healthcare professional. Up to mid-2002, I was just an ordinary person having a job in the industry. But we had a family drama when my son was diagnosed with Huntington disease after more than 10 years search and research, etc. When he was diagnosed, it was already in advanced stage. As you know, it's a neurodegenerative disease and something that you have in the family. So after Cedric, I happen to know that I am gene positive also, but in the gray zone. And we learned later on that my mother was also in the gray zone. My son was in the very advanced stage. So when you are aware of that, suddenly you see that the world is not what you expect it to be. And the first one is there are chronic and rare diseases. What is chronic diseases? It's 30% of the population. 30%, 3 million Belgians, of which 1/3 in need of multidisciplinary complex care. There are in Belgium 700,000 people suffering of rare diseases and with all type of fracture, social, human, cultural, material, professional, you can name it. So suddenly you are aware of that. Then you become aware also of the perspective of the world. World is changing. Healthcare organization is updating. We have reform of primary care everywhere in the world. We have new words, empowerment, patient involvement, complex multidisciplinary care for chronic disease, of course, new therapies, artificial intelligence. So, and we have also something new for me, that the place of care besides the place of cure. It's not only cure that is important, it's also care for people. And okay, that's perspective. And then I have some personal incentive. I want to be usefully active, or maybe actively useful, up to choice is not exactly the same. And with my focus, of course, of Huntington and rare diseases. And I became an activist with involvement in ethics committee, in the government plan for reform of the first line of care, and etc., and also in BBMRI Belgium. So that was the context. In 2017, neurologist of Erasmus came to me and said, look, in the hospital, we need now to have, by law, we need to have a representative of patients in our ethics committee to keep our accreditation and to be able to continue research, trials, etc. Would you like to be that person? I said, Jesus, what is an ethics committee? I knew a little, but not no more than that. And okay, I had a meeting with the chairman of the ethics committee, and he told me also a little. That's the profile. So you need to be affected by rare, chronic, and or disabling condition. Community-oriented, open-minded. Thank you. Helps literate, important. Able to translate into patient language. Colleagues have addressed the same issue. Work with disease-specific expert. And with a role, only participate in case review for every trial, assess document from a patient's perspective, evaluate clarity, relevance, credibility, etc. Exactly the same as you mentioned for BBMRI. So I put my focus not in the technical aspects. I am not a scientist, as I said before. So only the informed consent formula should contain, from my view, in lay language, clear description of the research, what's going on, clear description of the risk, the benefits, and if there are other possibilities than that trial, clear explanation of inclusion, exclusion rules, confidentiality, data, we'll come back later on data, colleagues have addressed also that issue, compensation if possible, and a contact person for the participation in the research. After about 10 years, 9 years in ethics committee, I have read more than 10,000 informed consent formula for project, more than 1,000. And I have some comments. Please limit lengths. Some documents are 50 pages document, 50 pages pharma companies, it's lawyer stuff. Avoid representation. Summary must contain what is essential for decision making and refer to appendices for details. All standard items, GDPR, data access, insurances, contraception, please validate it once forever and put them in appendices. Patient approval, not 2 pages, blah, 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 and up to the end, I agree. No. Per item. Each item you agree or you disagree with each item. And the investigator commitment. You know, most of investigators are signing, I comply with the Helsinki Convention, and I'm available for any question you should have later. Please, no, you are not available for question. You must sign that you have checked if the person who signs has understood what he's signing. And also on data retention must be absolutely clear. I come back on that later. So critical point is data collection and use, because it's through that process that you are building confidence. Must be very clear. What is data? Very few people understand what is data. Data are returned, some data, some samples will be collected. What's the nature of the data? What's the origin of data? What's the format of data? What will be the dispersion later on, the sharing of data later on? And the same with optional agreements. In the ICF, you have optional agreements for future study, future research, subsequent EC approval, external research, etc. Now, must be clearly option one by one, and it's possible that in the future we will be something with your data. Explicit opt-in and not an implicit opt-in. Explicit opt-in must be the rule. And then clearly define, it's an example, the difference between private and academic laboratories. Important to mention, use of artificial intelligence. Tell to one person that he has the right to opt out from a protocol where his data are used by artificial intelligence. It's simply impossible. So clear on data. Now, patient involvement is the key point of our presentation now. Patient involvement, what for? Research need, one idea, what should I research? Knowledge of the field and data. How to get sufficient data and share existing knowledge. It's cooperation between academic, public, private. But for patient involvement, you need to build confidence, and confidence starts with information. I believe personally that BBMRI is excellent for multiple pathologies, but sometimes for specific pathologies, like Huntington, for instance, you have other possibilities like enroll. You have also other possibilities with cooperation with caregiver and caretaker in full life care pathway from cradle to coffin, to take an example. So time is passing now very fastly. So how can I, as a patient, contribute to BBMRI? Make the patient voice audible at the BMRI node. And it's what I'm doing in Belgium, the same as I do in our meeting in the patient pillar, stakeholder pillar. But also make the existence of BMRI visible at the patient associations. I guess I have a colleague from LALUS. LALUS is our umbrella for patient associations in French-speaking Belgium. And also, they have a role also to play, because most of the discussion we have is, I think they are German in the audience, but it's a lot of wir zwischen uns. And we need to know that we have to go to the public and inform the public. Building trust is through communication to target groups, and target groups should receive a tailor-made communication. It's exactly what Sarah said before. Going to the young adults or the teenagers in their late 10 years. So building trust, communication, clarity opt-in, opt-out, and granularity of options. And with all of that, reader-friendly communication, nothing too scientific. I will not come back on the two booklets. I made the 3 points for the 3 and 4 points for each of the two booklets that you released. Where Eric mentioned the full content, so I'll skip it. But also one important point is to put the emphasis on the ISO certification that you have, because that can make the difference and that can build confidence. It's not only an ordinary, that it's a certified data bank. To build confidence with the patient, it's important to mention it and to explain what it means. So we are too late. If there are questions, I can elaborate later on the example of Enroll HG for the community, Huntington community. And just in a nutshell, for future discussions, the future, you either write it or you endure it. If you don't take care of your future, someone else will do, but not necessarily in your interest. And I have a last one for you that I had this morning. If you are failing to prepare, you are preparing to fail. So I still have some answers, but do you have some questions? Thank you.
Thank you, Albert.
Okay.
I will stop sharing, and actually we do have some questions. So I hope everyone can see us now. So thank you very much for the speakers to share with us their perspectives and involvement. And as I said, we actually do have some questions. So we can start with the first question that is from Esther. She is asking if there are any useful tools or practical tips how biobankers can measure, monitor impact of patients, parents, public involvement in their work. So I saw Eric was answering also in the chat. Maybe Eric, you want to first answer on this?
Yes, I would like to try. First, it is really difficult to evaluate this work, so it's not easy. But there are some tools that are published, so we can send them to you. That's mainly in scientific publications, and they show you which items and how you can do this. So we can send them to you. But it is difficult, and it's also very important because that's also something that you can give them in return to show them, well, we evaluated, this went good, this went not good, and that gives more value to their contributions also. Yeah.
Thank you, Eric. I think Sarah also wanted to answer on this question.
Yes, I think I agree. It's a really tricky question because we all have a limited amount of time and the resources for this. So we want to make sure that the actions that we do take have impact. And the only way of knowing that is measuring in some way. And we actually discussed this before we were meeting a group of senior citizens that took contact with us in Biobank Sweden and wanted to learn more about the law. And we said that absolutely, we can meet you. What would suit you? And what questions do you have that you want us to answer? And then we also discussed this in length. How do we measure the trust that we have now? And how do we measure if it was worth our time and effort? And we discussed with a few of the few representatives from the actual group that was coming to us, and they said, so ask the question to them. If you have some in that group, ask them. And they said we would prefer to get it in our physical mail. So we posted these to them. Physical papers is what this group, 65 plus in Sweden, would like to get it as a paper at their home. So we did that. And afterwards, like a few months later, we gathered the data again with the same questions to see if they have gained knowledge and if they've gained trust and if they have any comments to us. So it is tricky, but and also read all the papers and research that has been done, but also just ask the group, how would you prefer, if you have any? If you don't have any, then you have to do a best guess. But if you have someone in the group that you can ask them how they prefer it, because I don't think that would be the decision that I would have made. Like, would you please send it to my physical home? I don't think I would have answered, but they wanted that.
Thank you, Sarah. Albert, you would like to comment?
Yes, I would like to comment, because it's also a question of communication and to some extent of marketing. And it would be interesting for Biobank to release once a year the number of survey, study, trial that they helped to put in place. We do this with Enroll, and on the site of Enroll, everybody can see Enroll has supported over the past year so much trial, so much new surveys, so much release. So it gives confidence to the person who gives their data that something is made with their data. You do not need to go into all details. Okay, as much detail as possible, but okay, I cannot elaborate on this. But it would be a motivation for person to give, because they know that someone with usefully will make interesting use of their data. And it's not only stored in somewhere, Biobank for many people, it's a bank. It's somewhere a safe. And not everybody will understand that sometimes it's only data, digitalized data, not only physical data. And it's important to know that what they gave has been used.
Thank you, Albert. I don't know, Ronnie, would you like to also comment, or shall we go to the next question?
No, I would like to comment. So it's not very scientific, I would say, but I really like the direct interaction with people. And when we do the guided tours with patients or with the public, it's always great to hear. I had some tours where people told me, yeah, my sample should be here. I was in the surgery 6 weeks ago. Where can I see it? So, and then I showed it, you should find it somewhere over here, but when you tell me your name, I can't tell you the pseudonym of the sample, but it should be somewhere over there. And she was really happy, because I told her probably your sample has been used 2 weeks ago when we had a scientific project using breast cancer samples. So I think it's not a big group you have there, because the capacities are low, but such direct interactions are always the best, and direct feedback.
Thank you, Ronnie. Then we have a question that goes a bit more in the practical part. The question is, what practical strategies have you found effective for recruiting and sustaining PPE members? Maybe we start first with the biobank perspective, and then we come with the patient perspective. So Ronnie or Sarah, if you would like to start first, and then we come to Eric and Albert.
Yeah, as this is more or less on the side of our sample providers, I can tell you how they are doing it, but what I guess is they try to show them the benefit they have. And they are doing lots of outreach events. And I think the people really like to go there, get in interaction also with other people. And that's how they get them working, or they keep them working for such projects.
Thank you. Then Sarah?
It's good to have a mix if you can find people often via the patient organizations. Of course, it's our main way of finding them. But you need to have someone like Albert, who knows the system a bit now. He's involved in a lot of things, so he knows how to translate. And when someone shoots too high, he can tell you, that's not how you do it. You do it like this. But then it's also good to have someone who hasn't been engaged in many different things, that have more fresh eyes. So you need to try to have it sustainable. You can't just use the new people all the time, or the same people all the time. You need to get the new perspectives and have someone who has been around a bit, that knows, like, but this can be done because I've seen it before. So it's to have it sustainable, you need to have multiple perspectives, as always. Making sure the people with the lived experience have voices.
Thank you, Sarah. Then I would like to hear from Eric and Albert. How do they keep you motivated to continue to support in the different activities that you do?
I can tell it because I heard from my colleague. Once you come into this sort of non-for-money activities, you are infected and you cannot go out. It's up to now. You will do like Molière. You will die on the scene. Yeah. Okay.
Eric?
Yes, well, I agree. That's true, and it's also raw influence that you can have in things that go on and give your perspective. And I would also share. I agree with Sarah that first you go to patient organizations, but what we also try to do is go to more critical. Well, patient organizations can be very critical, of course, but there are also other organizations in society, like organizations who are watchful of privacy and who care very much about privacy. So you can also involve them and ask them for their opinions, and they're really fresh always. And yeah, so these are sort of venues that you can use.
Thank you, Eric. Then we have a question that it's more for Sarah. Given that there is an increasing proportion of age members of societies, looks like the Swedish Biobanking Act has discriminating the people with dementia spectrum conditions. Why?
Yes.
And I think she's also then adding on psychiatric diseases, which also includes.
Yeah, I agree, and that's why we're working so much together with the patient organizations on making sure that everyone in Sweden has the right to have their samples used for medical research if this is what they want. But I think I'm not the one making the laws, but I think the issue why they have put this clause, which I agree is a bit discriminating, is because they value the integrity. The integrity is a really, really, really big part of Swedish law, and therefore, in order to not make sure that someone who is incapacitated have their samples being used against their will, they have decided that we can't use any of them. And this is what we're trying to find good, healthy ways of making the law better than this. But the direct answer to the why question is personal integrity for people that are sick.
Thank you, Sarah. I think the next question is on the informed consent, which Albert shortly answered, but maybe I think informed consent is an important topic we think it needs its own webinar per se, because informed consent, it's something that it's often, you cannot have a universal one, but I can also let the speakers talk about it. But I would suggest we maybe skip now, and we will actually consider to do a webinar specifically on informed consent with the perspective from both the biobank and the patients, because this can also add quite interesting discussion. Now, coming to the next question, how the other EU countries deal with these subpopulations in their biobank clinical research efforts? So I'm assuming this is referring to the previous one on psychiatric diseases and patient being not included. Maybe, Ronnie, you can tell us how it is in Leipzig on patient engagement or involvement or participants in biobanks.
Yeah, as said, this is done by our providers, and we don't have it for every patient group. So we have, as I have shown it, we have it for cancer, and we have it for the children, so for healthy children, and that's all. So I would love to see that a little broader, reflecting what we have in the biobank. But as you said, it's you need capacities to do that on a single biobank level, and that's not really easy.
Thank you, Roddy. And as we are really coming to an end, I would like to ask each of the panelists to give a recommendation or a suggestion to our participants today. How can they increase their PPE activities in biobanking and research? So we start with Eric, Albert, Sarah, and Roddy then. Please, Eric.
Okay. Thank you very much for the opportunity. Well, I suggest you visit the BBMRI-ERIC website and check our paper. That also contains examples and literature, so maybe you can use that. Thank you.
Thank you. Albert?
It's what I just right now put on the chat. communication is a key topic to inform people and to motivate people to come and play with us. And we have put communication, by the way, on the agenda for 2026 for the Belgian note of BBMRI.
Sarah, please.
My tip would be that even if it feels big and hard, just start somewhere. Have people with lived experience look through one of the websites that you have. Just start somewhere, because as soon as you get to talking to these amazing people who only want the world to get better, the same as you do, you get really inspired, and then their energy keeps us going. So just start somewhere and take inspiration and get inspiration from wherever you can. Ask us in Biobank Sweden if you want. Just start somewhere.
Thank you, Sarah.
Yeah.
And
I would also say, open your doors, start doing it, be yourself, because communication is what we are doing in our everyday life.
Thank you. I would like to thank all of you for really joining us for the webinar today, and thank you for the speakers and panelists for being with us today. You will find the recording online, and it will be shared also broadly with everyone. Thank you again, and I wish you a nice afternoon.